So I wanted to make a quick video here talking about the spinal cord, okay? Something really interesting happens between the vertebrae here at L1, L2. So normally what happens is, like between T11 and T12, nerve T11 is going to come through there. But what happens around the lumbar enlargement is that they start to travel down more. The nerves travel down more because this is where the spinal cord ends. The conus medullaris, right around L1, L2, this is where the spinal cord ends. Now, there are plenty of nerves still continuing down in the spine, but the cord itself is ending there. Now, the string of nerves that come down are also called the cauda equina. The cauda equina really is just this loose, spaghetti string of your sacral and coccygeal nerve here, okay? But what's important here is that, if you have an issue with your sacral nerve 1, sure, it's in the area between L5 and the sacrum, but it is beginning all the way up here, close to where your lumbar vertebrae are. If you are having an issue with lumbar nerve 5, sure, yeah, it is exiting right below the 5th lumbar here, between L5 and S1, and it's even traveling up, and we'll talk about what a herniation is in a second, but it's beginning all the way up here by like where the thorax is. So if you have an issue up here you have some type of transection or issue, in the lumbar enlargement, which is just as you're getting to the L1 vertebrae here, yeah, that's going to affect a lot of things. That could essentially affect your 5th lumbar nerve and what it innervates, okay? The important thing here also is that when we talk about a herniation versus a compression, we talked a lot about nerve L4, nerve L5, and nerve S1, and what they innervate, and more importantly, what symptoms to look for when there's an issue there. But when you think about a herniation, and I believe it's the nucleus pulposus that comes out, the herniation between L4 and L5, if there's a squeezing here and when it herniates backwards, we are going to affect nerve L5, okay? Nerve L4, which I did not draw here, would exit through here, but it really would be fine because it's kind of coming in right before the herniation happens. I know it's kind of confusing, but the herniation is going to go posteriorly and affect nerve L5. Now, a compression, if there's like a tumor or something in this intervertebral disc, or L5 and S1 there's pressure but there's no herniation, then you are going to have an issue with the nerve in L5. So that's what I understand so far. If there is a herniation here of this disc between L5 and S1, it's going to be that S1 nerve that is going to be affected.